stop right there. Before you take another blood pressure reading, before you pop another pill, before you walk out of your doctor's office nodding your head, you need to hear this. Most people over the age of 60 have been told a number, a target, a goal, and they've been chasing that number for years without ever asking one simple question. Is that number actually right for ME? Because here's what the medical world has quietly been debating for the past decade. The normal blood pressure guidelines for older adults have changed. They've been argued over, and they are not one size fits all. Today, we are going to break all of it down in plain, honest language. No medical jargon, no confusion. Just the real truth your health depends on. Welcome back. If you're new here, this channel is all about helping older adults and their families make smarter, more confident health decisions. Because you deserve real information, not just a rushed 5-minute doctor's appointment. Today's topic is one of the most searched and most misunderstood health topics among adults over 60, blood pressure. Specifically, what number is actually considered healthy for someone in their 60s, 70s, or 80s. Now, you've probably heard the classic answer all your life, 120/80. That's the gold standard, right? Well, not exactly. And that's exactly what we're going to unpack today. By the end of this video, you're going to understand what the current guidelines actually say, why the ideal number can be different for different people, what happens when blood pressure goes too low in older adults, yes, too low, and what signs you should never ignore. So let's get into it. For decades, doctors used a very simple rule. Blood pressure should be below 120/80 for everyone. Young, old, male, female, it didn't matter. Then research started piling up, and something interesting happened. Scientists began noticing that older adults who were aggressively treated to hit that 120/80 target were actually experiencing more falls, more dizziness, more hospitalizations, and in some cases, worse kidney function. That started a massive conversation in the medical community. The American College of Cardiology and the American Heart Association updated their guidelines, and now the recommendation is a bit more nuanced. For most adults, including those over 65, the goal is still to keep systolic pressure, that's the top number, below 130. But for older adults, especially those who are frail, have multiple health conditions, or are over 80 years old, the target might be more relaxed, sometimes up to 140 or even 150 systolic, depending on the individual. Why? Because in an older body, the risks of low blood pressure can sometimes outweigh the risks of slightly elevated blood pressure. Here's something most people don't realize. As we age, our arteries naturally become stiffer. That's just biology. And when arteries stiffen, the heart has to pump a little harder to push blood through them. This means a slightly higher blood pressure reading in an older adult may actually be the body doing exactly what it needs to do to deliver blood to the brain and vital organs. If you then take heavy medication to force that number way down, you might actually be starving the brain of the blood flow it needs. This is why some older adults who are over-medicated for blood pressure start feeling dizzy when they stand up, start falling, start feeling mentally foggy or confused, because the blood isn't getting to where it needs to go fast enough. The medical term for this is orthostatic hypotension, but the simple translation is, their blood pressure is dropping too fast when they change positions, and it's dangerous. In fact, falls are one of the leading causes of injury and death in older adults, and blood pressure medication is one of the leading contributors to those falls. That doesn't mean you should stop your medication, absolutely not, but it does mean that the conversation with your doctor needs to go deeper than just hitting a number on a chart. Here's the honest answer, and I know it might feel unsatisfying at first. The best blood pressure for an older adult is the one that keeps you safe, functional, and feeling well, and that number is personal. For a healthy, active 65-year-old with no other major conditions, aiming for under 130 systolic is a perfectly reasonable and evidence-backed goal. For a 78-year-old who has diabetes, chronic kidney disease, and a history of falls, a doctor might intentionally allow the blood pressure to sit at 140 or even a little higher to reduce the risk of dangerous drops. For someone over 85, especially those in nursing care or with significant frailty, the target might be even more relaxed. The key takeaway here is this: your blood pressure target should be a conversation, not a command. If your doctor has simply told you, keep it under 130, without discussing your age, your other conditions, your medications, your activity level, and your history of dizziness or falls, then you need to go back and have a deeper conversation. You have every right to ask, is this target right for someone in my specific situation? Whether your blood pressure runs high or low, there are certain warning signs that should send you straight to a doctor or emergency room without delay. On the high side, watch for a sudden severe headache that feels unlike any you've had before. Vision changes, chest pain, shortness of breath, or confusion. These can be signs of a hypertensive crisis, and they are medical emergencies. On the low side, and this is the part many older adults miss, watch for dizziness when you stand up, feeling lightheaded after meals, fainting, sudden weakness, or extreme fatigue. These can be signs that your blood pressure is too low or dropping too quickly, and they need immediate medical attention. Also, if you're monitoring your blood pressure at home, and you absolutely should be, make sure you're doing it correctly. Sit quietly for 5 minutes before taking a reading. Don't take it right after eating, exercising, or having caffeine. Take it at the same time each day and track the results in a notebook or an app so you can show your doctor real patterns, not just one-time numbers. Medication is one tool, but it is not the only tool, and for many older adults, lifestyle changes can make a powerful and lasting difference in blood pressure. Reducing sodium in the diet is one of the most impactful changes you can make. The American Heart Association recommends no more than 2,300 milligrams of sodium per day, and ideally closer to 1,500 for those with high blood pressure. That might sound complicated, but in practice it means choosing fresh foods over processed ones, reading labels, and being mindful of restaurant meals. Regular physical activity, even just walking 30 minutes a day most days of the week, has been shown in multiple studies to lower systolic blood pressure by 5 to 8 points on average. That's comparable to some medications. Managing stress, getting consistent sleep, quitting smoking, and limiting alcohol are all additional pieces of the puzzle that can meaningfully shift your numbers. These are not optional extras, they are foundational. And the beautiful thing is, these habits don't just lower blood pressure. They improve your energy, your mood, your cognition, and your overall quality of life. Here's what I want you to do right now. Today, not tomorrow. First, write down your most recent blood pressure readings. If you don't have a home monitor, consider getting one. They're affordable and incredibly useful. Second, book an appointment with your doctor and go in prepared. Ask specifically, given my age and my health history, what is the right blood pressure target for ME? Don't accept a generic answer. Push for a personal one. Third, take a serious look at your sodium intake this week. Just for 1 week, track it. You may be surprised at how much is hiding in foods you'd never expect. And finally, share this video. Share it with a parent, a spouse, a sibling, a friend, anyone over 60 who is managing blood pressure and might be chasing a number that was never designed with them in mind. Because the truth is, the best thing we can do for our health is stay informed, ask better questions, and refuse to be passive patients. You deserve a healthcare plan that fits your life, not a chart made for someone half your age. If this video helped you, hit that like button, subscribe so you never miss an episode, and drop a comment below telling me, what's the one thing you learned today that surprised you most? I read every single comment and I want to hear from you. Stay well, take care of yourself, and I will see you in the next one.